For many people, Johannesburg's iconic city skyline and leafy suburbs symbolize gainful employment, wealth, success, and urban sophistication. Think of Hillbrow, however, and you're more likely to think of a deprived inner city area characterized by poverty, crime, and disadvantage. But in recent years, a number of projects have begun to return Hillbrow to the vibrant community it once was. One of these is the 28 million rand joint venture between Vodacom, Altron, and Altech, which has transformed the once derelict Van Niekerk Operating Theatre into a state-of-the-art facility for maternal and child health care. The Vodacom Altron Altech Centre for Specialized Health Services, better known as Shandukani, is situated in the heart of the Hillbrow Health Precinct and is concrete evidence of the ongoing revitalization of Johannesburg's inner city.
Shandukani and the Hillbrow Health Precinct are a world first. The opportunities for health and social services, for community upliftment, for inner city regeneration, and particularly for the conservation of heritage and for world-class research are enormous.
For me, it was one of those true working triple Ps, you know, public-private partnerships that not only with government alone, but just within the group itself.
Access to quality healthcare is a right for all South Africans. And at Vodacom, we understand that to operate successfully in a country, we have to be part of the solutions that helps to further government's mandate to provide all South Africans with access to quality healthcare and quality education.
We, as Altron, we have always wanted to have a flagship program, a CSI flagship program. And when we were approached with regard to something that is as important and as a country problem as HIV, in particular HIV in respect of women and children, we thought that this would be a good opportunity for us to get involved and to make a difference.
South Africa faces many challenges, and we cannot expect government alone to tackle these issues.
We identified a couple of key trends or areas that we wanted to contribute toward. Urban renewal was on there, world-class HIV/AIDS research was on there, and primary healthcare was also on there given the needs of the country. So when the Shandukani project came to fruition and the opportunity was there to invest in it, it really met a lot of our needs.
Shandukani is a Venda word meaning change and reflects the change that public-private partnerships can bring about. This transformation of a disused building into a world-class health centre is breathing new life into an inner city community. Shandukani is a focal point around which further public-private partnerships can take place. Shandukani brings a high-tech health and research facility to a community characterized by above-average rates of HIV and TB, and ensures that women and vulnerable children have access to expert medical care and integrated treatment on their doorstep. The sympathetic development of the Hillbrow Health Precinct and the rejuvenation of the inner city were major considerations as this innovative public-private partnership mapped out its plans for Shandukani. With significant heritage value and historical importance, it was imperative that the building's architectural integrity was preserved while incorporating modern clinical functionality. A professional team of architects, civil engineers, project managers, and tradesmen worked tirelessly to make this vision a reality. Time had taken its toll on both the interior and exterior of the building, resulting in the need for extensive repair and specialized remedial work. Existing paint was removed, walls repainted, and the exterior sealed with a waterproofing spray. Wherever possible, original materials were reused and retained. These included existing plasterwork and grano and terrazzo flooring. Wooden doors were sanded down and restored to their original beauty, and frames added to enhance the arches in the passageways. In addition, original courtyards and verandas were retained and windows refurbished to allow wide opening and good airflow, very important in preventing the spread of germs, an approach originally taken during the early 1920s and 30s. In addition to the main clinic, the second floor houses a cutting-edge research facility for the Wits Reproductive Health and HIV Institute, known as the WRHI. This challenging part of the project involved removing the slanted roof of the extension and replacing it with a glass and steel floor. The result is a modern high-tech look that nevertheless is completely harmonious with the beautifully preserved architecture of the original structure. In addition to its role as a working labour ward and maternal health facility, Shandukani will be used to train healthcare providers, community workers and researchers, and is home to a world-class research team working on a range of health-related topics of national and regional significance, including HIV and AIDS, TB, maternal and child health care, infectious diseases, reproductive health, and social science. Between 200 and 300 babies will enter the world in the facility each month. With HIV prevalence in pregnant women estimated at 30% in the area, almost 90 of these women giving birth are likely to be HIV positive. They will receive the most up-to-date care in preventing mother-to-child transmission of HIV. The antenatal clinic is expected to see approximately 800 expectant mothers per month. This will make Shandukani one of the largest non-hospital-based clinics of its type in Southern Africa. The WRHI has a long-standing commitment to health services provision and social transformation, especially in Johannesburg's inner city. The WRHI recognizes that partnerships of this nature are crucial to addressing the long-term challenges we face as a country in transformation.
Our investment in Shandukani is just one of the means by which we continue to touch lives in the communities in which we operate, as we firmly believe that people are our prime asset, and we remain committed to continuing sustainable investments in their well-being.
Shandukani represents a major step forward in the Hillbrow Health Precinct. We would really like to thank everyone who has contributed to this extraordinary project. This will make an enormous difference to the people of Hillbrow and more broadly to Johannesburg and to South Africa. Thank you.
Shandukani stands as both a tribute to Joburg's rich architectural past and a model of public-private cooperation for integrated healthcare delivery for the future, not only in South Africa, but on the African continent. Johannesburg can be proud.